Yes, so we're going to move on to 4140, Office of Statewide Health Planning and Development. Page 8 on the agenda. We'll hear from Director David with OSHPD.
Thank you, Madam Chair.
Good morning.
Good morning, members. I've been asked to provide a brief overview of our programs and budget. Then we will be talking about our single BCP, which is implementing chapter legislation. With me today, I'm Robert David. I'm the Director of the Office of Statewide Health Planning and Development, also known as OSHPD or OSHPOD, depending on your pronunciation. I'm joined today, to my left is Lupe Alonso Diaz, who runs our Healthcare Workforce Development Division, and she'll be answering a couple of questions you had on a couple of oversight questions. Mr. Ron Spingarn is to my right. He runs our Healthcare Information Division, and will be presenting our budget change proposal. The Office of Statewide Health Planning and Development advances Californians' access to safe, quality healthcare environments by focusing in 3 primary areas: healthcare workforce development, healthcare data collection and reporting, and healthcare construction and financing. We have 2 areas of the department focusing on health workforce development, the Healthcare Workforce Development Division, as well as the Health Professions Education Foundation, which is a 501c3 foundation. Our health workforce development programs seek to increase access to healthcare for underserved communities and populations by ensuring that California has a diverse and culturally competent and linguistically competent health workforce. We focus on, our programs focus on hard to recruit and retain health professions. We work to increase the geographic distribution of California's health workforce, as well as we explore new service delivery models through our healthcare workforce pilot programs. Our Healthcare Information Division serves as a healthcare data collection and reporting hub. We collect healthcare data from nearly 6,000 healthcare facilities licensed by the Department of Public Health, as well as some healthcare professionals licensed by the California Medical Board. This includes confidential hospital patient records, as well as public aggregate utilization and financial data. We make much of this data available to the public, the media, researchers, policymakers, and others. We also produce measures, analyses, and reports on healthcare quality and outcomes and other related health topics. Our Facilities Development Division is our largest division. We are the building department for California's hospitals and skilled nursing facilities. We administer the Seismic Safety Program, which is focused on strengthening California's hospital buildings so that they can remain operational in the event of an earthquake or other disaster. And then finally, through our Cal Mortgage Program, we provide health facility construction loan insurance for California's nonprofit and public health facilities so they can gain access to low-cost financing for their capital construction needs. Our proposed budget for 2015-16 is $147.5 million and 483.6 positions. Our department is funded primarily by special funds. Many of them are fee-supported. We have a small amount of federal funding, $1.4 million in 15-16 for our workforce programs. And we have our one major budget proposal for your consideration today in the area of healthcare data collection. And unless there are any questions for me, I'll turn it over now to Mr. Spingarn.
Any questions of the director before we go on? Go ahead. Thank you.
Good morning, Chairwoman Mitchell and committee members. I'm Ron Spingarn, Deputy Director of the Healthcare Information Division at OSHPD. This legislative BCP requests authority for OSHPD to implement Senate Bill 906, which was signed by Governor Brown last year. It would authorize special fund spending of $372,000 in 2014-15 and $319,000 in ongoing years from OSHPD's California Health Data and Planning Fund. to make permanent a pilot program that was tested by the Department of Public Health from 2008 to 2014. The law created by SB 906 allows the Department of Public Health to certify hospitals that do not have surgical backup services on site and meet certain requirements to perform elective medical procedures called percutaneous coronary interventions, or PCIs. These are used to treat or prevent blockage in arteries that can lead to stroke or heart attack. Two of the conditions that hospitals must meet to be certified by the Department of Public Health to participate in this program are that they must report data to a national data registry, and they must authorize that registry to release their data to OSHPD. This BCP will enable OSHPD to pay to access the data collected by the National Data Registry and hire a consultant for the first year to set up the program, and it would create 2 full-time permanent positions, a research scientist 3 and a research program specialist 1. Their ongoing work would include producing an annual public report of 3 specific performance measures for each of the hospitals in the program. Regarding a question asked in the committee analysis for today, we would make our reports consumer-friendly by engaging with consumers and consumer advocates, and by applying best practices for communicating with consumers in the design of the report to address literacy, language, and cultural issues. This will include addressing how the information is presented online and on mobile devices, and we look forward to working with consumer advocates, and I look forward to answering any questions that you might have.
Any questions?
Thank you for your presentation. Is this information going to be transmitted electronically with the consultants on board to gather this information? I assume it's going to be somewhat in a dashboard form.
Are you talking about how we would collect it from the registry or how we would present it?
Both. So how you would collect it and how you would present. Would it be collected electronically and would be presented in a dashboard fashion, the way we monitor hospital activity?
Yes to the first part. We'd collect it electronically.
Okay.
We would have to contract with the National Registry to receive the data on the hospitals that submit it to them.
Okay.
That would be transmitted to us through a secure process to get the data. And then in terms of how it would be presented, it remains to be seen. We would need to actually work with consumers and people who would be using this. Mm-hmm. It might look differently in a static report as opposed to on a mobile device.
Right.
So there might be variation in how it would be presented.
And then my only concern is that originally when SB 906 was passed, you had a certain budget amount that you would be needed to be funding what you're doing, and it appears that it's like twice as much. Is that correct, or is that not true?
I'm not sure which figure you're looking at.
The appropriations estimate for your program was one figure, and then I'm learning that it's twice as much as what was originally proposed.
I think the committee analysis noted there was some funding for the Department of Public Health. This figure, the committee analysis had noted it was around $300,000
okay.
for our office, and it is roughly around $300,000.
Okay.
Any comment from finance or LAO? None. Okay, I'm going to hold all public comment until we get through their entire section 4140, and we'll take the public comment on all the items. Okay? Moving on to
Yes, I think you had
the
a
Peer
question.
Personnel Support Investment in Mental Health Wellness Act.
Yes, I'm going to turn over to Ms. Alonso Diaz for that.
Excellent.
Thank
Hello.
you, Director David. Good morning, Chair, members. Lupe Alonso Diaz, Deputy Director for Healthcare Workforce at OSHPD. This informational item is with respect to peer support personnel. As you may know, in fiscal year 2013-14, OSHPD received a $2 million appropriation for peer personnel. The purpose was to provide training in peer personnel support functions such as crisis management, suicide prevention, recovery, and case management. In April of 2014, we awarded 4 contracts. Those contracts are 2-year contracts. Those contracts end June 30th of 2016, so we are in the middle of those contracts. There are 4 particular objectives for those contracts. They are to develop pathways, recruit peers into the public mental health system, train those peers specifically in items and issues that are relevant to recovery, crisis management, suicide prevention, and finally secure placement in the public mental health system. To date, the contractors have trained 192 peers, and 96 of those individuals have been placed in the public mental health system. For this fiscal year 14-15, we released the RFA February 27th, and it's due April 16th.
Any questions? LAO, Finance? Okay, this is an informational item, so we won't be taking action. Thank you. We'll move on to the oversight of the Sound Brong Residency Program.
And I'll ask Ms. Alonso-Diaz to answer your question. However, I did want to take a moment to thank the legislature for recognizing the need for more primary care practitioners in underserved communities. And that's really been the focus for years for the Song Brown program. I really think that program is making a difference at a time when we really need more practitioners, as we've got millions of Californians with a health insurance card for the first time. And access to care is going to be a continued issue for the next several years. And many of these practitioners work in community clinics in underserved settings. And I do appreciate it. And I'm glad you're asking these questions about what impact, and we welcome these questions. So.
Excellent.
Madam Chair?
Yes.
Thank you.
Go ahead, Mr. Stone.
No, I agree with your comment. We need more primary care practitioners, especially with the Medi-Cal program. We got a third of the states that's enrolled. Just one final comment with regard to OSHPD. I guess the one complaint that I hear in my area of Riverside County, we've added two new hospitals in my district, surgery centers, and that sometimes is the bureaucracy in getting through OSHPD, the time it takes to get plan checks back. Is there any initiative within your office to streamline applications? Obviously, we want to not review things that could put any patients in any kind of harm, but is there any kind of a streamlining process that you're undertaking to kind of be more customer friendly, if you will, and so they have a timetable when they submit an application, whether they're putting a new wing on a hospital or building a new hospital, they have a firm timetable that's not taking years to get through. It could be taking months to get through, because not only is this economic development and constructing new facilities, but more importantly, it's providing health care for our communities, especially in some of the more rural communities that I also represent, the eastern portion of my district.
Yes, and I'm glad you asked that question, Senator. There's a number of things that we're doing, and just generally speaking, I'm very sensitive about the cost of health care. I think we all are now that the Affordable Care Act is being implemented. I think we need to focus on the affordable part, and we're going to try to do our part to do that. We have implemented for smaller projects under $500,000 in construction costs, which represents about 50% of the plans submitted to us. We actually have a dedicated unit where plans are submitted electronically to us. We call it the Rapid Review Unit. And we have a goal of getting those plans back to the designer in 21 days or less, and we're meeting that goal.
That's great.
For larger projects, we also have, we're moving towards an electronic review format. We have a phased plan review format that we use where, rather than the entire project coming to us at once, we'll review it in phases, and we'll say, start on this increment. And we're definitely meeting our goals. We're working with industry more constructively, and we're looking at other ways to amend the building code where we can to move things along, but not to, as you mentioned, not to negatively impact public health or safety. And hospitals, we're to the point in the implementation of the seismic safety law. The next big deadline is 2020. 89% of hospital buildings as of today are compliant with the collapse standard, so that buildings won't collapse in a major earthquake. And all hospital buildings as of today are on a path to compliance by 2020. So we're working, and we'll continue to work to make things faster, cheaper, but not less safe.
For new hospital constructions, that we've seen in my area, Temecula Valley Hospital, Loma Linda Hospital, what is the amount of time that you're seeing with hospitals, 300 bed, 400 bed, going from the beginning to the end, going through the OSHPD process? Give me the range of the time period that a hospital
Well,
would expect to go
I'll
through?
give you some examples.
The ideal and
We're actually starting to, the next deadline after 2020 is the continued operation deadline, basically, which is a much higher standard. So the building not only remains standing, but patients need to be able to stay. You know, many of them are fragile, and it's difficult to relocate them. So the building has to remain operational. We're actually having some hospitals come to us now talking about they're doing their 2030 planning. So it can take, you know, these are major investments. There's a lot of change going on in, obviously, the healthcare community. We're actually seeing a number of projects, the big projects, being put on hold right now. I think a lot of hospitals are trying to figure out what are inpatient needs going to be going forward. You know, what are the capacity needs, as well as do we want to bet, you know, $500 million right now when there's so much uncertainty in the healthcare system while we're in this transition period. Loma Linda is one hospital that we're reviewing currently, actually. They're one of the bigger ones that we're looking at.
But for a new hospital going from A to Z, what is the OSHPD time frame that one would be looking to? The ideal situation, of course, and what the reality is.
Well, every project is different. You know, we try to get, when we first get plans submitted, our goal is to have, for large projects, is to have our first comments back to the designer within 60 to 80 days. And currently we're meeting that. A few years ago, we were not meeting that, and there were a couple of reasons. There was a deluge of plans coming in because of the seismic safety law. Right. And then we had the unfortunate budgetary times, and so we had some employees that were on furlough, and that really made it tough for us. But we're back to where we should be, and we're tracking that very carefully.
Okay, so again, just a range, 300, 400-bed hospital from beginning to end, a year, 2 years. What would you say is just a guesstimate?
You know, if plans are submitted to us today, are you asking when the building will be completed or when they'll start construction?
When OSHPD gives the final approvals for the construction to begin, that process.
Well, you know, within 6 months.
6 months. Oh, that's great.
Yeah.
That's very good.
And we'd be more than happy to work. In fact, I encourage at the front end, any big hospital project, we encourage them to actually come up to Sacramento to meet with our team at the front end, so we can determine timelines on both sides, because they're, you know, they've got to keep their own design teams feet to the fire as well, and we encourage that.
Does OSHPD have an ombudsman program so that
we do?
They do. Good, great. I applaud that.
And I'm the ultimate ombudsman too, and I encourage any.
Yes, you are.
I encourage any member of the legislature or any hospital CEO to call me personally if they're having issues.
We appreciate that.
Senator Monning.
Thank you, Madam Chair. Just on that, I'm encouraged by the data you shared of the number of hospitals now in compliance, and narrowing that universe that are all in progress of retrofit. So that provides us some assurance, because in past years, as you know, we've been asked to support extensions so that an existing project we don't lose hospital services, particularly in a rural area. So it's encouraging, because those extension votes, I think we put all of our communities and the legislature and your department at some risk of what if. So I'm glad there's been persistence in apparent compliance. I wanted to focus back on the item before us on the Song Brown residency program, and really not a question, just to offer my strong support for this program. In my district, we have a training hospital in Salinas, Natividad Medical Center affiliated with UCSF, and that the evidence is clear over the years. People who train in the Salinas Valley are more likely to stay and establish their professional careers as primary care physicians, family practice physicians in the community. And when you add the expanded access and eligibility of previously underserved communities, even with this, we're going to be woefully behind the ability to provide qualified providers, but this is certainly an important component. So I just encourage support for this item and thank OSHPD for providing the oversight to move this augmentation forward. Thank you.
Why don't we move into Ms. Diaz's presentation on Song Brown?
Thank you. Thank you, Chair, members. With respect to Song Brown, as you indicated, thank you, Senator Monning, the purpose of Song Brown is to do a couple of things, but the core focus is to increase the number of underrepresented minorities in primary care professions. The idea, as you said, is that in terms of cultural competency, that individuals have an opportunity to receive care from individuals and practitioners that understand their community, that understand the diversity of Californians, as well as that provide primary care services. Now, in terms of the practicum of Song Brown, the requirement is that they then provide that training, those clinical rotations in underrepresented communities, with the focus that if we recruit and retain practitioners in underrepresented communities like medically underserved areas, health professional shortage areas, they're also likely to stay there after their residency ends. With respect to fiscal year 2013-14, as you know, we did receive 2 augmentations. One is a one-time $4 million augmentation. The purpose is to support new slots. The second appropriation is a 3-year annual appropriation of $2.84 million, and it's to expand the Song Brown program beyond family medicine to include other primary care specialties, specifically internal medicine, obstetrics, gynecology, as well as pediatrics. For both of those appropriations, we created a task force that was representative, that was comprised of individual stakeholders as well as alum, medical school graduates, residency directors, et cetera, in order to ensure that we had broad representation as we developed the request for assistance, the RFA. We released the RFA on January 22nd. That RFA is due March 10th. And the California Health Workforce Commission will be meeting April 28th and 29th in order to make those funding determinations. We expect that for the new slots component, that we would fund 13 programs and 26 residents. For the expanded beyond family medicine, the expansion to other primary care specialties, we expect to support 25 programs and 53 residents.
LAO or finance? So why don't we, thank you very much for the presentation. Why don't we open it up for public comment on anything under 4140 OSHPD? Are you coming up? Okay. Looked like you were out for a Sunday stroll. I wasn't quite sure if you were moving to the front of the hearing room or.
Eduardo Martinez, California Medical Association. Just wanted to speak on this last item around the Song Brown funding. Wanted to thank the committee, committee staff, OSHPD as well, and obviously echo the director's comments about the importance of this funding. We wanted to keep working with the committee and OSHPD about maybe talking about securing this funding sort of over the longer term. Mm-hmm. This funding has been particularly helpful. However, some of the residency programs that we're hearing from need to have some sort of reliability of funding kind of going forward, right? Mm-hmm. You know, the residency programs that need to be able to hire the faculty and have the, you know, the facilities, what have you. So thank you again, and we'll look forward to working with you.
Thank you.
All right. Jody Hicks, representing the California Academy of Family Physicians, and really just echo CMA's comments, and also thanking again for the appropriation last year to start the $4 million for the new slots, because we think that's really important to grow workforce, and also thanking OSHPD, who did a great job of having stakeholders and robust information to start this program. So we look forward to working with you to try and find a way to keep it going. Thank you.
Thank you very much. So we're going to hold open the item on the percutaneous coronary intervention program just to allow staff further time to evaluate the need for the 2 additional FTEs, and all the other items were informational. So thank you very much for coming today. Appreciate it.